So this is something personal I'd like to share with you, and this is about being a good doctor, probably about being a good person as well. Now, I'm not professing to be a good doctor or a good person, because we all have our moments and days, but I want to give you something to think about how you can go about being a slightly better person or a slightly better doctor. And this is through a personal story. I have a family member that's got cancer, and it's a stressful time, even for me as a doctor, being a doctor for more than, I can't remember, 30 years. Because it's different when it involves you directly. It's a fine line walking between surgery, rehab, and waiting to hear the outcome of the surgical histology. Really, really difficult time, of course, especially for somebody who it comes from a different generation. I know that cancer nowadays, depending on the type, can be considered a chronic illness. I know that it can be navigated and can be managed, similar to what HIV was like when I was a junior doctor. That was a death sentence. It's not anymore. It's a chronic illness now. So it was a difficult time. So my mum's in hospital waiting for, feeling very vulnerable, and a physician walks in who she's never met before, who's covering her physician, and basically says to her, "This is likely to be incurable. You need to get your affairs in order." Chit-chat, out. Completely devastating interaction with a doctor. Have you had this experience before? Have you done this to somebody yourself? Again, no judgment here, a discussion. My thoughts, my views, my feelings. So I'm angry. Call up the doctor, have a word with the doctor. "Did you know what you've just done? My parent has been fearful for this type of disease all her life because she's watched people around her get this and have terrible time through chemotherapy and finally succumb to cancer. And you've walked in and stated a few things and essentially walked out and left her completely and utterly broken in this very difficult time for us." The doctor professes to tell me that she was a good doctor, did what she thought was a right thing to do, and doesn't apologize for what she has done. So I remained quiet, calm, and hopefully I got my thoughts and views across, and nothing really came of the discussion. I said to her, I am not sure she's come across as a good doctor, and perhaps she should consider the way she talks to some patients, particularly vulnerable patients without a family member with them that she's never met before. Anyway, I'm getting agitated. We wait for the surgeon that night. The surgeon arrives, myself, my dad, my sister, we're all there, and we have a discussion. It's a tricky discussion because he tells us the histology results. He tells us that 32 lymph nodes were taken out. All 32 lymph nodes were clear, so there was no distant spread. That's incredibly relieving for all of us, even me as a doctor. So it's optimistic. There's no positive lymph nodes. There is no spread. There are some lung nodules. This might be related to previous smoking. This might be related to living in South Africa, where TB is essentially endemic. But the nodules are well circumscribed. They're very round and very neat. This doesn't look like a cancer, so it's unlikely to be anything of relevance. There are some other issues that we need to assess and deal with, but essentially the news is good. Now, he made us feel hopeful. He made us feel optimistic. So now we have a strategy with a medical oncologist, rehab, and we have optimism and a little bit of hope. It's the same story. One person delivered a devastating message. The other person delivered a message of hope. So the doctor that barges in has no context about the situation, past history, past family history, worries, fears, none of that. Why would you not? You're a doctor, and supposedly a very good doctor. You're dealing with somebody that's had a cancer diagnosis or awaiting a cancer diagnosis. Of course they're going to be fearful. Of course they're going to be scared of things. Think about it. Anyway, the difference, this is the moral, I'm getting to the moral of why I'm sharing this with you. The difference is not the story, the difference is how the story was delivered. And this is something that I had witnessed firsthand. Now, me being a pain specialist for more than 20 years, I can't help everyone I see and treat. I do my best, of course. Some days I have good days, some days I don't have good days. What I do try and consistently deliver is a message of optimism and a message of hope, no matter how dire the situation. So I think one of the most important factors of being a good doctor, it doesn't matter whether you're a physician, it doesn't matter whether you're a surgeon, it doesn't matter whether you're a pain specialist, junior or senior, no matter who you interact with, no matter where you are, as a doctor, you can absolutely provide optimism and hope, no matter what the situation. And if the situation is really dire, and I mean really dire, you can sit with your patient, hold their hand. The surgeon looked at my mum and said, "It looks like you need a hug." And they did. And it was incredibly heartwarming. And my hat goes off to the surgeon, because that must be a hard thing to do often. And I know this because I'm a doctor. I don't deal with people at the end of their lives. I've dealt with palliative care patients in pain, excruciating pain, family members. And of course, as an anaesthetist, I've been in the emergency department, and I remember a story where I had a patient who was traveling from the USA to London. And he was an elderly guy, and he looked the wrong way crossing the road because he's in a different country. Stepped in the road and was hit by a car. He had a massive brain hemorrhage, and there was no way he was going to survive this. And I had to talk to his wife, who's on their holiday of a lifetime in London. They've just got here, and tell her that essentially he was dead. And I was a relatively junior anaesthetist at that time. I think I might have been a senior registrar. And it was a difficult discussion to have, and I just had to sit with her and just be with her. And I remember that interaction as well. I don't know if I gave her optimism or hope, of course, because it was an absolutely dire situation, but I just sat with her. And I sat with her for a long time. So one of the most important things about being a doctor is optimism and hope. And sometimes it's okay to be quiet, I suppose. But bloody hell, just think about what you're saying.